So let's start about the emergency medicines. The first one is the epinephrine. It is an adrenergic agonist. It is prescribed in the anaphylaxis. It increases heart rate and the blood pressure. The next one is the atropine. Atropine is an anticholinergic drug. It is used to treat the bradycardia. Next drug is the lidocaine. It is an antiarrhythmic drug. It is prescribed in the ventricular arrhythmia. Next drug is sodium bicarbonate. Sodium bicarbonate is an alkalizing agent. It is given in the condition called metabolic acidosis. For example, if we see some common examples here, this is the epinephrine. This is the epinephrine. Epinephrine will stimulate the beta 2 receptor and it causes the bronchodilation and therefore we give in anaphylaxis. Next, it also stimulates the alpha 1 receptor and it causes the vasoconstriction. As a result, it increases the venous return to the heart. This bronchodilation occurs in the lungs and this vasoconstriction occurs in the blood vessels. Next, see the second example is atropine. Uh, in this, we have to discuss some concept. We know that our farmers, to protect the crops, they spray some insecticide or the pesticide. In this image we can see this farmer is spraying some pesticides in his crops. This insecticide or pesticide, they have some chemicals, for example malathion, parathion and the diazion. All this together are called as OP compounds. The word OP means organophosphate compounds. This organophosphate compound increases the muscarinic effect. This organophosphate compound increases the muscarinic effect. We know that the muscarinic effect are the parasympathetic effect. So whenever farmers try to do suicide with the help of this insecticide or pesticide, farmer doing suicide by taking insecticide or the pesticide, this compound will increases the parasympathetic activity, that is in the form of muscarinic effect, and it shows the symptoms of diarrhea, urination, meiosis, bradycardia, bronchoconstriction, emesis, lacrimation, and salivation. Due to this bronchoconstriction, there is a respiratory failure and it causes the death. We can see this is a pesticide. Here, the chemical, that is the malthion. This is an OP compound, organophosphate compound. This was about the atropine. Next, let's see about the adenosine. Adenosine, it is given in the condition of arrhythmia. Especially it is given in the trachyarrhythmia. We know whenever the heart muscles contract and expand, there is sufficient cardiac output, but whenever there is no contraction or there is no proper contraction, the heart only vibrates, then there is decrease in the cardiac output, and This cardiac output, decrease in the cardiac output, will not supply enough blood to the system. So this was about the some emergency medicines. Okay, thank you.